You'll see it.
Right. One more slide. And with that, we have about 10 minutes, but I wanted to put this slide here. And the reason I really think it's so critical that Dr. Anna was here and Dr. Gilberto was here and that Louis set this up, this is the critical importance of this. These 6 factors impact what we do to live, learn, and laugh, right? Think about that. If I can't pay my rent, I am not going to be laughing. I'm not going to be thriving and living well. If I can't pay my rent or I live in a neighborhood because of my income that may have violence, that's going to impact my ability to exercise, which impacts my health. That's going to impact my ability to socialize, which is going to impact my laughter. My grandmother had a 3rd grade education. If you don't have the ability to read a document we give you, it's going to impact your health and what happens. If you can't read what I've given you, that's huge. And one of the things I've talked to Louis about, like really intentionally, like when we think about what we want to do is how do we help individuals who live in the community to understand a document that they've been given that has all these words that I think it's at a 6th grade level, but my grandmother's not going to read it. She's going to bring it home to me. But what if she doesn't have a Dr. Susan at home? What if she doesn't have a family member that understands that? We have to think about those pieces. We're not going to get patients to buy insulin and medications and pay copays if they have insurance, if they don't have food to feed themselves and their children and their partners. It's not going to happen. So these are real things that impact our well-being as we think about how do we create an environment where we can bring our whole self, but be a healthier whole self. And then this community, safety, and social context. This is about race, gender, ethnicity, culture. What is our social context around us? What are we exposed to that influence what happens to us? Those adverse childhood events really came out during COVID. COVID did just give us a picture of what has been happening, but just shows us how clear it is that we have to address these issues. And I always tell people, healthcare is a small component of this. In most cases, when I'm seeing a patient, they're coming to me sick. All the other factors have already played into that. Our goal with the model we are wanting to create is to meet each person that chooses to come and see us where they are at. So if someone comes and says, Susan, I need help to read this prescription or this document that says I need a procedure, and I'm not sure I should have this procedure. What do you think? That I have the ability with the students and the learners in our program and others that come around us to support this work and say, this is how you do it. If someone has a question about wastewater and its impact on the community, and Anna shares data, we want to share that with the community. What can we do differently? So we really want to make sure when we come in, we're creating a supportive community model based on the need of the community and meeting those needs. And I am willing and always, I always tell people I'm willing to network and flex, because if I don't know the answer, I know Louis knows the answer, or Dr. Gilberto will know, someone is going to have the answer, or the person that we can reach out to provide that service. So I'm going to stop here because we have about 8 minutes, and I want to make sure if people have questions or if Louis wants to say anything else. But just again, Ithaca College PA program coming alongside our alumni to provide a service to the community that the community says they want in the form they want. And we can do that with everyone's help, including PA programs that are in California, and then leveraging our relationships here in Ithaca. In our school, we have PT, OT, speech language pathology, public health. We work with Cornell in the healthcare administration school. I have a partner there. So we have lots of people that we can work with to make something happen. And I want to go back to this picture because I think a picture is worth 1,000 words. Look at the smile on this young man's face. Let's envision that he lives in SPA 6.
Yes.
And we did Project Access. And we mentored him throughout. He's in high school. He's in middle school. He's going to high school. Mentor him throughout high school. He gets a scholarship and comes to Ithaca College for undergrad. He gets a scholarship and attends Ithaca College PA program. He moves back to SPA 6. And now he is the face of your community, serving you with the help of Lewis South and Ithaca College PA program.
Well, that makes me feel good. I got to work for more of that. I want to say I do have some things real quick to say. First of all, everybody who spoke today, I knew you were dynamic speakers and would share something of value. It came through. It gives me hope, all right, because right now I need hope. You know, I need to know that there's a developing something. I've really prayed on this, that there will be a mushrooming. I even work with one friend. She is a Buddhist. We chant every day, and it feels great. And I just want to say that this is how it happens. You know, this is human interaction through the media. Okay, here we are on a webinar, but it's happening. It's live and it's action and it's happening. And I want to say that for all of you who participated, thank you, thank you, thank you. I have a million questions for Ana Marota. Get ready. I'll write you. And, you know, Gilberto Rosales, he's my neighbor, and, you know, we've always been tight. I haven't come to him for anything in years. So this is the first time I'm coming in years. And he says, oh, you're still around, you're still doing it. I'm a community guy. And so everybody usually says, well, you know, Lewis will do it. Whatever I present that needs to be done, I'm trying to get other people involved. And their attitude is, he'll do it, though. You don't have to do it. So no, this is the problem. But we have it now where this is something I'm too old and it's too big. What we need to do is some serious work to maintain. We are blessed. We have an excellent community here, and we are blessed with that idea. It's not talk, it's real. Everybody comes and says, is it always this quiet around here at night? Always, unless the police have a reason to be flying in the helicopters. He said, oh man. But we know what really is a community about. It's all about communication. That's what makes a good community. If that's not happening, no matter what your color is, how much money you make, you know, what your background, that doesn't matter. It's the willingness to communicate with others who are especially different from yourself. You know, we have a great mixture of people here, and it's happening, and we've not lost that, and it's not a mistake. We are very conscious of that and the simple things that we do. I want to just say really quickly that you've all been really blessed to be in the position that you're in. The one question I have right now for Ana Marota real quick is, has there been, from all of this data collection, because it seems like epidemiology, I should have said that when I introduced you, forgive me. Epidemiology is your area of concern.
Oh, yeah. Yeah.
And if I understand it correctly, it's all about tracking diseases and, you know, the effect that they're having in a society. Could you say that from all of this data collection on COVID or SARS-2, are we finding ideas coming up as people are, you know, living in these communities where many communities are taking measurements and looking? Any ideas came up yet that stand out to say, well, what do we do to try and work against that, the negatives?
To work against sort of like stigmatization of communities, is that?
Stigmatization. How's about the how do we protect ourselves from this? Has there been any ideas coming up from that?
So Anna, I'm going to ask you to answer the question this way. We have 2 minutes left, and we want to make sure everyone has a moment to give one closing statement. If you could answer it within the framework of, as you've given this talk and the work you've done, and you know what we're trying to do, what do you see as the one thing you want us to walk away with to help us to be successful in any models we implement?
Yeah, I would say be open to including wastewater surveillance in whatever model you implement. That's all. And be curious about it.
Yes.
Thank you. Dr. Rosales. Can't hear you.
Or does he have a speaker?
Yeah, can you hear me? Yeah.
Oh,
Yes. Go ahead,
Yeah,
Dr. Rosales, closing remark. One thing you want to make sure everyone hears before we walk away.
That we work together and we integrate as many people from the community, students or volunteers, to reflect the community actually and work together.
All right. And my closing remark is thank you, Lewis. Thank you, Ithaca College, for making this happen. I am happy to do what it takes to make this happen with the help of Lewis and the resource there he has in California. And we want to thank you all for being here. And I am a military person, so I like to honor the hour, and we're right at the hour. So be well, take care, and see you next time we're in California.
thank you.
Thank you.